Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Hello, everyone, and welcome to 5 to Thrive Live. I'm Karolyn Gazella, and I co-host this show with my good friend, Dr. Lise Alschuler. So over the past 30 years or so, I've focused on educating people about integrative oncology. Some people have told me that they want to use an integrative approach, but it can be difficult. And I agree. It can be hard, but the effort is certainly worth it. On this show, I had the perfect expert to give us advice on how to proactively create an integrative cancer care plan. Terri Crudup is an integrative oncology researcher, author, educator, and patient advocate. She is also the lead author of the new book, Taking Care of the Whole You. It's an ebook that she published with the Society for Integrative Oncology, a wonderful organization. But before we start our conversation, I'd like to thank our sponsors, beginning with Cetria, a patented form of glutathione clinically proven to raise blood glutathione levels. Glutathione is the master antioxidant and the body's primary defense against free radicals. It also helps support respiratory health. For more information, visit cetriaglutathione.com. Also, cognizant citicoline, which is nature's way of keeping the brain's energy-producing centers firing on all cylinders. If you're looking for a way to enhance your brain function, including memory, focus, and attention, look for Cognizant on the label or go to cognizant.com for more information. ProThriver's Wellness Brain is a product that contains Cognizant, as well as other brain-supporting nutrients and herbs. You can find ProThriver's Wellness Brain online at pureformulas.com. There's also ProThriver's Wellness Sleep, which combines higher dose melatonin and other sleep-supporting natural ingredients specifically designed for thrivers. You can find ProThriver's Wellness Sleep also at pureformulas.com. And Dr. Ohhira's Probiotics. It's a best-selling probiotic for more than 30 years, and it contains 12 probiotic strains that are shelf-stable, so no refrigeration is required because of a unique 3-year fermentation process. It's a very effective probiotic. Learn more at drohhiraprobiotics.com. Well, Terri, thank you so much for joining me.
Yeah, thank you, Karolyn, for having me. I'm very excited to be here.
Yeah, well, I'd like to start, before we dig in, tell us a little bit about your cancer experience. You are a cancer survivor, so what type of cancer did you have, and how are you doing now?
Sure. I was diagnosed first with stage 0 breast cancer, so that's known as DCIS. That was in 2013, and I had a unilateral mastectomy. They checked a couple lymph nodes and kind of sent me on my way. And then it came back 6 years later. So that was 2019. And actually one of my lymph nodes had turned into a tumor, a rather large one. And that got me into surgery to remove 20 of my lymph nodes. It turned out it was 8 of them. I also had 8 rounds of chemo and 25 rounds of radiation. And so this second time was really, my wake-up call. And I found Integrative Oncology through an organization called Unite for Her. They're a wonderful nonprofit that helps with breast and ovarian cancer patients. But I really I wasn't at a health system that really was integrative. I created my own plan working with Unite for Her. I changed a lot of my own lifestyle choices, like movement and nutrition and stress management. And I've actually been living, I think, a healthier life for the past 6 years. So now I'm 6 years out from my second diagnosis. And I actually just had a circulating tumor DNA test done. And I'm happy to say I'm completely cancer-free and I think really healthier than I was before cancer.
Great. Well, that is great. And it's great that you were proactive and created your own integrative cancer care and that the cancer care program. And that's what we're going to talk about today. But there can be a lot of confusion. How do you define or describe integrative cancer care?
Yep. For me, it's pretty simple. It's the combination of the conventional medicine. So I just talked about, surgery, chemotherapy, radiation, targeted therapy, immunotherapy, kind of everything you might picture your oncologist from our Western part of the world prescribing, plus lifestyle modifications like movement, nutrition, sleep, and then other complementary therapies, things that really can help you balance your mind, your body, and your soul. So things like acupuncture, yoga, mindfulness, meditation, qigong, and supplements is a big one that patients talk about a lot. So it's really, it's the conventional medicine plus lifestyle and complementary therapies.
Yeah, it's the best of all worlds when it comes to cancer care, right?
Yep, absolutely. I think so.
So, when talking to people over the years, I've found that one of the biggest barriers to integrative cancer care has been resistance or negativity from the lead oncologist who's just sometimes not willing to work with an integrative plan. Now, do you feel that that has changed or is changing, or is that still a pretty big barrier?
Yeah, that's a great question. I've been in this field only for 5 years, so I'm a novice compared to you, I think, Karolyn. But I do feel like I've done research with oncologists in the US. So this is not integrative oncologists. This is, over 100 institutions represented in a national survey. And I did that for 3 years in a row. And what we found was there's actually a lot of oncologists that believe in integrative oncology. They believe it helps with side effect management. They believe it helps patients feel better as they go through treatment and improve their quality of life. And there's a good third of them that even believe in the survival benefit of adding lifestyle and complementary therapies. But I do think, even though it might be improving over time, Karolyn, there's still so many practical barriers that it's hard for even the doctors who believe they might not be in a system that supports delivering integrative oncology. Does that make sense?
It does. It does. And I want to talk about those barriers, but let's stay with this question because I would say I agree with you 100%. So I have been doing this for like 3 decades, and I have noticed a shift and I have noticed that it's gotten better, but we are nowhere near where we need to be when it comes to integrative cancer care. So I would agree with you. So what can listeners do if their specific oncologist is unwilling or hesitant
Mhm.
to work with them to create an integrative approach?
Yep, that's a question I get a lot. So, first, I do think it's important that patients try to have that discussion with their oncologist or with their broader care team, because even though the things that we're talking about here are very safe, very low risk to using them, there are, for example, some supplements that interfere with chemotherapy. So, it's just important, I think, to try to have that open relationship with your doctor. And, if you don't, or if you feel like your doctor or your oncologist isn't willing to hear that, I actually do counsel patients to seek out second opinions.
Mhm.
And that's, for a variety of reasons. It doesn't have to just be related to integrative oncology, but generally you want to be with a care team that you're vibing with, for lack of a better term, someone you feel you can have that discussion with. It doesn't mean they're going to support everything that you're asking. It just means you feel comfortable at least having the discussion and being open about it. And a lot of patients that I talk to say they are really glad they got a second opinion, even if they didn't switch. Like, I'm an example of someone who got a second opinion and then went back to my original health system. I just needed the reassurance at that point in my treatment plan.
Mhm.
So beyond kind of just thinking about the discussion, if you don't have the energy or like the motivation to explore changing, so maybe that's not an option for everyone, and I get that you're already in your treatment, you don't want to think about changing. I actually did write into the ebook, which we're going to talk about a little bit, some tips. There's actually one page that's like a discussion guide, depending on how supportive your care team is. And so I'm just going to read a couple of the tips that I wrote into the book, because these are ways patients can actually approach their oncologist, maybe from a slightly different angle, to try to get more of that support. So one of them is, being actively involved in my cancer treatment is important to me. So other than following, the procedures and medications you recommend, what else can I do to have the best outcomes possible? So you're sort of acknowledging, yes, I'm going to use the medicine, the conventional medicine, but I want more. And that's one of the things that my ebook co-author, Bert Rosen, says all the time, like, what else? What else can I do? And hopefully you're with a health system that is going to help you answer that question. But if not, there's like one more push I have here, which is I've heard their guidelines from the American Society of Clinical Oncology, also known as ASCO, for using integrative practices with cancer patients. So, doctor, can you help me understand how the guidelines apply to me? So you're not just putting it all on the doctor, you're actually putting it on this like third party that's a very well respected party and saying like, look, I know this exists. Can you help me? And even if the doctor isn't willing to, maybe others on the care team are. So that's another question to ask. Are there other members of the care team who can help me? And maybe they'd send you to a nurse navigator or to a social worker. And I do think sometimes social workers, there's an association there that doesn't need to be there. They're very helpful. And there's no harm in asking for help. And the last step is just cancer advocacy groups. That's how I got my start. So you could ask your care team too, are there advocacy groups who can help me with resources to help my well-being while I go through treatment? And my final tip is, if you still are facing a wall, you're with a oncologist or care team that's not helping after all these questions, then you can use trusted resources. Again, I still encourage talk to your doctor about it, but the ebook that we'll talk about has a whole section on vetted resources for checking things like supplement uses and interactions, or finding community practitioners, even finding ones for low cost, who can help you to implement these things.
Yeah, and I love the way your questions are worded. And I think that, having the patient come across as being very proactive and I want to be a part of my healing, I think doctors love to hear that. So I think that's a great way to say that. I want to talk a little bit about the care team before I go into more barriers, because you've said it a few times, and I think that sometimes people don't understand that they do have a team. Who should be on that team?
Ooh, that's a great question. So it's really going to depend on what center you're at and how many resources they have. But at the very least, you obviously have an oncologist. You might also have like a radiation oncologist, a surgeon. This isn't just breast cancer, so a surgical oncologist. And then there's usually a host of supportive staff, which is a bit of there should be a stronger word for it. So the nurses, that can be a physician assistant or a medical assistant. It can be nurse navigators. It can be even like psychotherapists. Some places actually have psychologists on staff. And then social workers, I mentioned before, that I think are a huge resource for helping patients find resources. Like all of those people might be involved, and I'm probably forgetting some, so forgive me. Oh, nutritionist is a huge one.
Yeah.
Physical therapist, yeah. So again, it really depends though on the system that you're at, like the hospital. Some of them really do have that whole staff for you, and sometimes you have to ask. You'd be surprised. Sometimes there's a disconnect between the doctor, like knowing there's a nutritionist somewhere, but not automatically recommending that to patients. So being proactive and asking about it sometimes will get you there much easier than you think.
I would agree. That's a great thing, is to know who your team is and asking about it. And I think your team is going to enjoy that. You're asking about who's on your team. Okay, so what are some other barriers to integrative cancer care, and how can we overcome them?
Yeah. So I work, kind of at a macro level here. So zooming out from the individual patients, I think access and funding are two of the biggest barriers. So access meaning, how do we find that nutritionist or that exercise specialist or acupuncturist, whatever it is, and then funding. How do I pay for it? So I do work on kind of other angles with other organizations to help hospitals deliver or facilitate more integrative oncology, and then with policymakers, because there really is a strong argument here that it's worth paying for these things. Like think about your payers and how much they're paying for the actual treatments. There's a lot of evidence that says we can use integrative practices for a lot less money and get improved outcomes. So, at a big level, at a high level, I think we need to keep championing for that. That's the advocacy work that I do, macro. But then if I take it down to like, well, I'm a patient today, I'm living with cancer, or maybe I'm going through treatment, or maybe I'm in survivorship. So what are the barriers there? And there are barriers, because patients want to help themselves, but when it comes down to the practical aspects, well, do I have the time for that? Well, that's going to cost me some money. How am I going to figure that out in my budget? And so I ask patients, because I think this is an important part of getting there, is even if, every option that I've talked about was free and at your fingertips, would you use it? And it's easy to sit here and say, sure, I would use it, but actually practically applying it, I think is another barrier to patients. And so what I like to talk about is the why. Like, what is your why? And for a lot of people, when you are diagnosed with cancer, your why is, well, I want to be here. I want to be here and I want to feel good for the people I love. I want to watch them grow, or I want to be part of their big moments. Or if it's people and, your parents, your grandparents, I want to keep supporting them. Or maybe it's just as simple as I want to live and I want a good quality of life while I'm living. And so I think finding that why and linking the practices, the integrative practices back to your why, it's going to help motivate, because I'm sorry to say, but there's not a magic pill, that there's not an easy way. It does require work, that there's a reason these things are called practices. But, improving your nutrition, improving your exercise, calming your mind, if you can remember that when you're practicing these things, you're doing it to extend your life and improve your quality of life. And you really don't have to do a lot all at once. It can all be done in baby steps. And I think that's like my best advice for getting over the practical parts of it as a patient. And Karolyn, I'll tell one reframing story if we have the time here, because I love telling this story.
Yeah, go for it.
Cool. For me, my why was I want to be here for my kids, right? I have 2 young kids and my husband and my family, but I also kind of love science. And I realized there's a connection. At some point, I was educated that my thoughts lead to emotions that then elicit a hormonal response in my body that can either be productive to my health. So I can be putting myself in rest and repair, which is someone going through cancer is highly important. Or those thoughts can be what I would call counterproductive. So I can be in fight or flight. And fight or flight is, increasing your blood pressure and increasing your heart rate and increasing inflammation and doing things that are counterproductive to healing, basically. So I'm super motivated to monitor my thoughts and intervene when something is starting to spiral. And my reframing is a very simple technique where you literally just say, okay, something just caused me stress. How can I turn it on its side and help that stress go away? And my example is I celebrate Christmas, and Christmas 2020, which, if you remember, 2020 was the first year of COVID.
Mm-hmm.
I did our holiday cards like I always do. I ordered them online, pictures and, happy holidays from the Crudups. And I got them back in the mail, and I was getting ready to send out over 100 cards. We send a lot of cards. And I realized that nowhere on the card did it say our names, like not our first names, not our last names. It was just happy holidays. And I remember in a split second, my mind spiraled into, oh my gosh, I've screwed up. I'm so embarrassed. Everyone's going to think I'm so stupid. How am I going to fix this? Maybe I could write something on every card. Maybe I could put an insert in that I print out on every card. And like literally just spiraling within a split second. And I stopped and I took a couple of deep breaths, because that's a really good way to interrupt those thoughts. And I stepped back and I said, you know what? It's COVID. Like the whole world just fell apart this year. No one's going to care. No one's probably even going to notice. These are my friends. They know my name. My name will be on the address return label. They know who this card is from. And I ended up laughing it off instead of getting stressed about it. And I just think that's such a nice example of we can control it if we just take a minute and think and put in the effort to control it.
Yeah, I agree. I love that. That's totally something I would do. So I can relate to it.
Nice.
Um, and I love this idea of small steps, because what we're talking about can feel overwhelming. But if we do take small steps and we do prioritize based on the why, as you mentioned, that's all going to be helpful, and it's going to make it less overwhelming. Um, okay, I'd like to talk a little bit about the new ebook. Congratulations, by the way.
Thank you.
Um, Tell us, why did you want to create this, and what makes this ebook special?
Yeah, cool. I would love to. So, I mean, Carolyn, you mentioned in the beginning, I'm a researcher at heart. I do love research. And I got a couple of years into research for integrative oncology, and I realized there are so many great researchers working on this. There is not a lack of evidence. If anything, there's just more evidence we need to keep championing and educating about. And so I kind of pivoted to the practical parts, the how people can access integrative oncology, and again how they can do it for low or no cost. There are some things that cost money, but there are also some things that don't cost any money, like the reframing example I just gave. So the ebook is really all of the basics of what I've learned about integrative oncology and how people can adopt it into their lives. And when I say people, I do mean, it's not even only just people who are having cancer right now or living with cancer or going through treatment or in survivorship. These are actually things that caregivers can use. There's evidence that the doctors doing some of these things themselves makes them happier and less burnout. So anyone can adopt these kind of things. But what I wanted to do was present like a foundational learning. So like definitions, right? Like I think I might have used the term mindfulness earlier. I didn't know what that was 6 years ago. And I take for granted now that mindfulness is being present in the moment and without judgment. But not everybody knows that. So that's what the book starts with, is just very basic definitions of some of the most evidence-based integrative methods. And then it goes through the guidelines. So guidelines basically mean that some really smart organizations have looked at a lot of clinical trials, a lot of studies, and pulled out and said, here's what has enough data, enough science to support using these methods for things like pain or fatigue, depression, anxiety, nausea. There's all sorts of great guidelines that we've put in very patient-friendly language and with lots of visuals. So trying to make it as easy to digest as possible. And the other part of the book, the section 5, is the section I wrote myself. And it's my favorite because it's the practical tips for how to find the time to incorporate into your daily life, and then also how to get started, like I said, for little or no money. And so I'll read you a couple of the tips. It'll just take a minute, but I want to mention really quickly first that the ebook can be found on the website of the Society for Integrative Oncology. So that's integrativeonc.org, integrativeonc.org, and it's under the Knowledge Center tab. It's completely free. You don't even have to put any information about yourself in. We just want people to go and download it and use it. And then some of the tips that you'll find, when you go and look for this practical part. There's one part that says, I have no money. How can I get started for low or no cost? And, for example, the body part is linked to exercise. So body, mind, soul. So one of the body parts is exercise. And, I talk about walking is a great form of exercise. It's free. It can be done nearly anywhere. But, I definitely get from patients a lot, but walking is so boring. Like I can't motivate myself to do that. So there's little tricks like play a game when you're walking, find something blue, find something orange. Which house in this neighborhood would be your dream house? Which building is the tallest building? Listen to an audiobook, call a friend, bring a friend on your walk. Like there's all sorts of things you can do to make it a little more exciting. Don't take the same route every day. And there's other activities too. You don't have to walk. There's swimming, there's hiking, there's biking. But my point is, like, if that's your barrier, find something that works for you. And there's probably something you can do, and every little bit counts. Every little bit of movement is important. And my other tips are about, I'm a busy person with no time for new things. So how can I work this into my schedule? And I'll just give you a couple of those too. One of mine is, like, I call it find bang for your buck and get creative. So like I literally, when I'm at the bus stop with my daughter in the morning, we walk rather than just stand there waiting for the bus. Or like when I'm in the waiting room waiting for doctor to come in, small waiting room, but I walk in circles. I'm getting in my steps for the day. And then I love to put things on my calendar because then I make it happens. So block yourself a half hour every day for wellness, something simple, or an hour on the weekend if that fits into your schedule better. And then look for new time. I love new time opportunities, like your kids get a little older and they start going to school full time. That's found time you don't have to spend with your kids anymore before it gets filled up with something else. work in some wellness. And the same thing for if your commute time shortens. So I'll stop there because I know I could go on and on. There's plenty of tips if you download the ebook.
Yeah, those are great tips. So remind us again, what's the website where we can get that book for free?
Sure. It's the Society for Integrative Oncology, and it's integrativeonc.org.
.org, and it's the Knowledge tab.
Knowledge Center. Yep, you got
Knowledge
it.
Center. Okay,
Mhm.
cool. Okay, we have a few minutes left, and I know that you are also involved with a free app for people diagnosed with cancer.
Mhm.
Where can people get that free app, and what's entailed with that?
Yeah, sure. So the app is called Outcomes for Me. So it's outcomes and then the number 4 and then me, all one word. It is available on the App Store. So whether you're Apple iPhone or Google Play, either one, it's an orange icon. It's free. It's always going to be free. It's for anyone affected by cancer, patients, caregivers, professionals. And it is evidence-based as well. And there's already 300,000 patients in the US, in other countries too, mostly the US, who are on the app. And there's plenty of tools in there, Karolyn, as well as integration with the NCCN treatment guidelines so that patients can be empowered to really know, okay, what is recommended for me? And then you can go have that discussion with your doctor.
That's a lot of users. That's great. How long has the app been available?
The company was founded in 2017, and I believe it was a few years later, so about 2021, I'm going to say, when it actually became available.
Cool.
Yeah.
That's great. Well, this has been a great informative show. Thank you so much, Terri, for joining me.
Yeah, it's been great talking to you, Karolyn. Thanks for having me.
Yeah, great. And congratulations on the ebook and your health and everything. So let's keep in touch.
All right, definitely. And you too. I'm glad to hear you're doing well these days.
Yes, I am. Well, that wraps up this episode of 5 to Thrive Live. Once again, I'd like to thank our sponsors, ProThrivers Wellness Sleep Formula, Cetria Glutathione, the superior glutathione to support liver and immune health, Cognizin Citicoline to help enhance memory, focus, and attention, and Dr. Ohhira's award-winning shelf-stable probiotic. Thanks for listening, and remember, you can find past shows at ithriveplan.com and wherever you listen to your podcast, your favorite podcasts. That's ithriveplan.com. May you experience joy, laughter, and love. It's time to thrive, everyone. Have a great night.